Okay, let's continue with case number 16. A 12-year-old girl presents to the clinic with a sore throat and fever. She says she feels very tired. Physical examination reveals notable cervical lymphadenopathy, but the spleen is not palpable. A heterophile agglutinin test is negative. On histology, the image shown in figure 3-13 is seen. I try to hold it up to the screen a few times. You can't see it, but you should be noticing the owl's eye appearance. What is the most likely diagnosis? Infectious mononucleosis syndrome resulting from the Cytomegalovirus infection, CMV. CMV is a double-stranded linear virus in the family Herpesviridae. Infected cells have intranuclear inclusions and on histology have an owl's eye appearance, as seen in the center of that picture. What is the presentation of this condition? In the majority of people, CMV infection is asymptomatic. In those with symptoms, it usually presents with a mononucleosis-like syndrome, which includes pharyngitis, cervical lymphadenopathy, fever, lethargy, and less often splenomegaly. Unlike the mononucleosis syndrome seen with Epstein-Barr virus, the heterophile agglutinin test or the monospot test is negative. CMV can be transmitted by direct contact, blood transfusions, organ transplantation, breast milk, sexual contact, and vertically, which means from the mother to the fetus. It is one of the torches infections. The torches infections are toxoplasmosis, other infections, rubella, cytomegalovirus, herpes simplex virus, and syphilis. What populations are at risk for complications of this condition? The populations most at risk are those with decreased cellular immunity, such as patients with AIDS and organ transplants, especially bone marrow and lung transplants. The main complication in the transplantation population is CMV pneumonia. The main complication in the AIDS population is CMV retinitis, which usually presents when the CD4 cell count is less than 50 cells per millimeters cubed. In both populations, prophylactic ganciclovir can be given. How does this condition present in patients infected congenitally? In patients congenitally infected with CMV, the complications include petechiae, jaundice, microcephaly, microsomia, retinitis, neurologic abnormalities, and deafness. At-risk fetuses are those whose mothers have a primary infection, which is seen with high IgM levels. Remember that the IgG levels could be low or high. Mothers with low IgM levels and high IgG levels likely have a secondary infection and are more likely to be able to prevent transmission from mother to fetus. What is the appropriate treatment for this condition? Although most patients do not need treatment, the treatment is ganciclovir, a nucleoside analog. This drug requires activation by viral kinase, which phosphorylates the drug and allows it to inhibit CMV DNA polymerase. Acyclovir is not effective against CMV. What are the most common side effects of the treatment for this condition? Ganciclovir is more toxic than acyclovir. Side effects include leukopenia, neutropenia, thrombocytopenia, and renal toxicity.